Hey, what's up? It's Chris from Chris Beat Cancer, and today I've got an awesome interview coming at you. This is Ivelisse Page in Baltimore, Maryland. She is a chemo-free cancer survivor, and I actually can't remember how I found her. I stumbled across her somehow and thought, wow, this is a terrific story, and I wanted to share it with you. So, Ivelisse, thanks for taking the time to talk with me.
Well, thank you, Chris, for having me. I'll be able to be interviewed with you.
Okay, so why don't we start in the beginning? Kind of take us back to when you were diagnosed and what was going on in your life at that point.
Well, sure. Well, I was probably in August of 2008, and I really found myself fatigued that I was actually taking about 3-hour naps in the middle of the day, every single day. And when I woke up, instead of feeling rested, I was still feeling exhausted. And so for a while, I had convinced myself that it was because I was burning the candle at both ends. I was a busy mom of 4. I ran my own business in the evenings, and I'd actually been homeschooling my kids for 5 years.
Jeez, look.
Yeah, so it was a lot. So I said, I'm just tired.
I'm exhausted now. I mean, I'm ready to take a 3-hour nap.
That's right, that's right. But I finally realized that that was not normal, and my husband really convinced me that I needed to go find out what was happening. And given my family history of colon cancer, I knew that was a very real possibility. But up to that point, I was very diligent about getting my regular colonoscopies. We were eating organic food as a family. I was already exercising. My health was really a priority to me and to my family. But in spite of my best efforts, I became severely anemic and was admitted to the hospital and needed a blood transfusion. And this led to the colonoscopy, and they discovered that I had colon cancer. And I was actually diagnosed at the very same age with the very same type of cancer that my dad had died from when I was a little girl.
Wow. And how old were you?
At that point, I was 37 years old.
Okay. Anybody watching this, I was 26 when I was diagnosed.
Wow.
Okay, so what did they find? How big was the tumor and what stage?
Yeah, well, it was at 5 centimeters about. They said that they believed at that point that it was actually stage 3, that it hadn't spread to any of my vital organs. But after the surgery, they did a post-surgery scan, and then they discovered that it indeed had already spread to my liver.
Okay.
And I was at that point stage 4.
All right. So were you terrified?
You can say, it's funny because sometimes I tell people that fear can try and be even more so difficult than managing the cancer itself. So it really tried to settle on my family. Thinking about not seeing my children grow up and growing old with my husband. I remember feeling overwhelmed. And I had to convince myself that my story not necessarily had to be my dad's story, that, my outcome could be different. But truthfully, a big part of me, believed I was on the same path, diagnosed at 37, dead at 39. And amazingly, I could always hear those little whispers in my ear, especially after I found out, it had spread to my liver. And they told me I had a less than 8% chance of survival at that point. So we quickly realized, okay, I have a choice to make here. And am I going to give into this fear? Or, as a Christian, am I going to live by faith and fight? And so, we really had to go back to our roots and what we really believed. And we really believed that God did not give me a spirit of fear, and that He promised that He would never fail me, and that He would never leave me, and that He promised that He would be faithful even when I was all out of faith. So I just remember using His words to remain strong and courageous, and to quit being terrified and to just trust Him for my outcome.
I did the exact same thing. I love that you said that.
Yeah.
So what were they trying to get you to do? Were they trying to get you to do chemo and radiation, or did they tell you, it's not going to help? What kind of feedback were you getting from the doctors at that point?
Yeah, well, we actually interviewed 3 different oncologists at that point. After my surgery, And we were researching. My husband was in the wellness industry for 20 years, and so he was researching every anti-cancer approach possible that was out there. And in that process, we were interviewing oncologists, and all of them were saying the same basic routine where, chemotherapy, and that was the avenue I had to take. But we really wrote up a list of questions for them, and one of them was, okay, at this point when I was stage 3, should I go through with the chemotherapy? What are my chances of survival with the chemotherapy? And at stage 3, they said, oh, well, 67%. And we're like, okay, that's not bad. And then we asked the next question, which was, without the chemotherapy, my staging, my health, lymph nodes affected, what are my odds of survival, as a 37-year-old woman? And we were shocked. We were shocked to find out that the oncologist said 57%.
Wow, I'm surprised they told you that.
Yes, I was amazed, and we just both looked at each other and we said, you mean to tell me that we're going to destroy everything that is good for a 10% benefit? And, with my dad's history, I thought, goodness, after 25 years, I would think that there had been so many huge advancements, that I would have had an 80-90% chance of survival at that point. And we just really knew that that was just not the avenue to take. We just believed that. And in those weeks ahead, 2 people from different walks of life referred us to our natural physician, who's been using what I use to fight my cancer, Mistletoe treatments. And
yes, Iscador, right?
Yeah, yes, Mistletoe
Great.
Therapy, yes.
Hey, hold that thought, because I want to inject something really quick that is so important, and you just touched on it before I forget. But they told you had a 67% chance with chemo, 57 without, which is shocking that they admitted that. But these statistics are very misleading, and there is a landmark study in 2004 called The Contribution of Cytotoxic Chemotherapy to 5-Year Survival in Adult Malignancies. And yes, I am nerdy enough to have that memorized. But the point is, in that study, they found that chemotherapy only added, on average, about 2% to survival. And now that's average across the board for all cancers. It varies from one cancer to the next, but even colon cancer was still in that low 2 to 3%. So even the fact that he told you it added 10%, that is contradictory to this peer-reviewed published study that was in the Journal of Clinical Oncology. Mm-hmm. So, I mean, but it's amazing at the same time that he still admitted that you had a 57% chance of surviving. Now the statistics I've heard is that you have about a 60% chance of living 5 years, overall, for all cancers, for all patients. And then you can add whatever chemotherapy contributes on top of that. It might end up being 63% on it. But anyway, still, what he told you was pretty close.
Yeah, and that's one of the reasons we actually selected him. He was the only one that gave us the additional information with the questions that we had asked. And he was also, after we had made the decision that I was not going to go the chemotherapy route, and especially after we found out it had spread to my liver, which made it an even least benefit for me, we knew that I needed to get monitored by an oncologist. But many times, if you don't follow their protocol, I don't know if that happened with you, but many times they won't accept you as a patient. So thankfully for me, we said, Dr. Diaz, you are the one to monitor me, and we really believe in your. He was very positive and just an encouraging voice. And
hang on. So what's his full name?
Dr. Luis Diaz. He's at Johns Hopkins Hospital. Johns Hopkins.
Is that Baltimore area?
Yes.
Okay. And by the way, this is a really good tip. Don't miss it. Most oncologists, the oncologist that diagnoses you is not going to want to work with you if you decide against chemotherapy, typically. And so what most patients need to do is you need to find a new one. And when you find a new one, you come to them on common ground, because you say, listen, I have this diagnosis. This is what we've decided to do. I'm not doing chemotherapy, but I am changing my diet and my life, and I'm doing some other things. Will you work with me and monitor my blood work and order scans? And so when you come to a new oncologist with that approach, it works very well. But you can't expect the one that diagnosed you and is recommending chemo to want to work with you if you say no to chemo. So, okay, so you found you found an oncologist you were working with, and you were before I interrupted you, you were talking about the doctor of natural medicine that was using mistletoe. Now, this is a different doctor, right?
Yes, so actually 2 friends from 2 different walks of life within that same week actually said to me, Ivelisse, you need to meet with Dr. Hinderberger, Dr. Peter Hinderberger. And I knew that that was a sign that I really needed to listen to that. And we made an appointment with him. And
where is he?
He's in Baltimore as well.
Okay.
Yes, and I'll never forget, we were sitting in his office, and my husband had already set up this great protocol for me, and you know, with a special diet, you know, high alkaline diet that you talk about, and supplements, you know, that were necessary for my type of cancer. And he said, all of these things are great. He said, but Ivelisse, in my practice, the backbone of treating and preventing future cancer is mistletoe. And he says, you need something stronger, especially after the surgeries, that you can go in there and remove those microscopic cancer cells, and mistletoe will do that. And the great thing with it, that unlike chemotherapy, it will not have any side effects, and it helps to boost your immune system to fight, and especially when you're immune compromised after cancer.
So I want to reinforce this. Mistletoe, also known as Iscador, has been studied, excuse me, specifically against lots of cancers, but colon cancer especially. And there's even a post on my site about mistletoe and cancer. It's a research-related post, and I'll add a link somewhere on the video so you can click through and see that there is actual clinical, documented, scientific evidence. You know, everyone's looking for evidence-based research. It's out there on mistletoe. So then that begs the question, well, why isn't every oncologist using mistletoe?
Well, you know, it's interesting because I get asked that question a lot. And, you know, in the United States, if there hasn't been a clinical trial done here in the United States, oncologists, 1, they don't know about it, and 2, they cannot offer it as standard of care. And so what's really exciting about what we're doing, you know, through Believe Big is that Dr. Hinderberger, Dr. Diaz, and other Dr. Channing Poller from Hopkins, and the manufacturers of mistletoe, Weleda, we are all working together, and we're actually starting a clinical trial here in the United States with mistletoe in this coming year, so that it can be offered at cancer institutions, you know, nationwide.
This is like so freaking cool.
I know, I'm excited.
And I knew this before I asked you to do the interview, and so now anybody watching this will know why I'm so pumped, because clinical trials are very expensive, number 1, and very difficult to do, and most natural-based compounds like mistletoe, there's really no money in it because they can't be patented. And to spend the millions of dollars to get fund a clinical trial for a product that really can't be patented, you're just kind of throwing money away. And so that's why most pharmaceutical companies, in fact all, they're not interested in natural compounds and natural methods, and they're not interested in nutrition. And people say, oh, it's not evidence-based because there's, you know, the reason it's not evidence-based is because no one will spend the millions of dollars to get this, quote, evidential clinical trial basis. But anyway, so they're doing that with mistletoe. But before we talk about Believe Big and the clinical trial and all this really cool stuff, will you talk a little bit about your diet and the supplemental protocol and some of those things too? Because I know people are thinking like, well, what'd you do? What'd you eat? You know?
Yes. Well, we had already started I had been following Jordan Rubin's The Maker's Diet for years, and you know, we actually just adjusted that, and we eliminated a lot of the meat, and especially for colon cancer, you want to avoid red meat. I still did eat organic chicken, but I don't eat a lot of it, you know, being cautious of portion sizes. So instead of, you know, they always say, you know, the chicken breasts that you find, you know, are the size of your hand, I would take a half a portion, you know. So I was really
4 ounces, right?
Yes, yes.
So tell me, so like in terms of meals, like what would be a typical breakfast, lunch, and dinner for you. And were you juicing or doing fruit smoothies?
Yeah, I was doing juicing. I also was taking Juice Plus, which also helped on top of all the fruits and vegetables that I was taking. I was taking a juice that a friend of my mom's actually told me about that was really helpful, which had a little bit of beet and a little bit of apples, and she would juice this for me every morning, and I would take it. I was eating a lot of greens for salads with salmon on top. You know, my typical breakfasts is Ezekiel muffins. I would have a little bit of eggs, organic free-range eggs. You know, the main thing that I really tried to avoid, and I did avoid, I was very strict on, was white flour, and I completely eliminated sugar. Not even that little piece of cake during birthdays and all of that, because we're in the middle of a battle, and when you're trying to fight something as strong as cancer, you need to go all out and be serious about it. I will tell you that now, almost 5 years out, I will have, you know, that treat now and then, but it's not a common occurrence. It's a treat.
Well, you know, for the average person, you know, it's what you're doing 80% of the time that makes the most impact on your health. And so if you focus on being super healthy 80% of the time, 80% of your meals, then that gives you the freedom to enjoy what I call recreational food, you know, ice cream and pizza and cake and stuff like that. But the problem is the standard American diet is so unhealthy that based on one statistic, you know, it's about 88% unhealthy and about 12% healthy, and that 12% includes fruits, vegetables, nuts, and whole grains, and all the rest of it is too much meat, too much fat, too much dairy, and too much refined and processed sugar and flour. So anyway, without rabbit trailing too hard, so were you eating a lot of raw food? It sounds like you were eating a lot of plant foods and whole foods. Were you eating did you focus on raw foods, or it sounds like you probably eliminated processed food, right?
Yes, I pretty much did. Yeah, the way that diet worked was, you know, eliminating basically the sugars and the white flours, and I did eat cooked. You know, I know that one diet that I actually recommend now, and actually you featured it, was the Gerson diet. It's just a great diet for fighting cancer, and I wish I would have known about it back then. But knowing that my husband was very well versed in nutrition, we just kind of followed what we had always done, which is absolutely organic, a lot of fruits and vegetables, making different variety of foods based on that. But I ate both raw and cooked vegetables.
Cooked food. Were you a little worried that because you had been following that diet already that think it wouldn't work?
No, I really didn't, because I really knew that it was only helping my body. It was feeding it. I think that was one of the reasons I was surprised that I actually got colon cancer, because I was doing, quote unquote, all the right things. But one of the things that I didn't realize were some of the things that my body was weakened, and I didn't even realize, like, you know, iron deficiency, and not to get on a whole nother topic, but immunizations that I had to take for a trip that I was going on, and things that really made my immune system shut down a bit, that I think introduced the cancer. But I really, really believed in what we were eating and what we were doing, and with the mistletoe alongside of that, I really felt very confident that we were going to do well and beat it.
What does mistletoe therapy look like?
Yeah, well, for each person, it's very individualized, and that's what I love about the complementary piece. Is the conventional piece, you know, they do the scans, they do the blood work, and they monitor you in a conventional sense, which is great. You need that. The complementary piece, what I love is that it's very individualized. So they look at you as an individual person and say, what is your specific body deficient in? What nutrients do you need to infuse it with? What supplements, based on your blood work, does it need to really help to fight? And in the case of mistletoe, what they actually do is that they have you take a series of extracts, and it starts from like D all the way to F. And once your body has a reaction to it, it's almost like a little mosquito bite size reaction. It will say that is the right extract for you, and knows that that's what's working well for your body. So even though someone may have the same type of cancer, same type of staging, your internal environment is completely different. So you may need a different extract than what I was on. And at that point, I was taking mistletoe subcutaneously every other day. And
What do you mean? Like, explain subcutaneous.
it's an injection. It's almost similar to a very tiny diabetic needle, and it
Okay.
comes in a liquid form.
And so it wasn't IVs, it was just a needle
No,
injection.
needle injection
You did it
in my
yourself?
stomach, and did not hurt. I do it myself. I am not a needles person, so I was like, really, every other day? But it was very simple to do and painless.
By the way, I didn't mention this earlier, but mistletoe is used extensively in Germany and Europe and Mexico and other countries outside the U.S. So it's really not a new thing.
No.
It's been around a while, but again, you don't hear about it in the U.S.
Yeah, it's used all over the world actually, and no, actually for the last 100 years it's been used for cancer treatment. It's used widely in Germany and Switzerland for cancer treatment, and you know, the benefits of it that a lot of people aren't familiar with, and I have them written down here, is, you know, they work with malignant and non-malignant tumors. Mistletoe helps to stimulate bone marrow activity. For those individuals who do go the conventional route with chemotherapy, it does help to offset the nausea, the vomiting, the lack of appetite. It helps to diminish tumor-related pain. And then lastly, which is why I'm still on it, and I take it 2 times a week now, it helps to prevent reoccurrence. It keeps to maintain your immune system strong and fighting for your body.
So you're coming up, or right at your 5-year mark, right?
Yes, 5-year mark.
That's great. It's exciting.
Yeah.
I mean, that's a milestone.
It really is. It really is.
Congratulations. My 10-year is in December, and I had a colonoscopy earlier this year. It was great, no problems, all clear. So that's excited. I mean, it's exciting. I'm excited for you. You know. Okay, so let's talk about Believe Big. So since then, you've started this foundation. I can't believe you've really pulled this off, because it's so cool. So you've got this oncologist, and you've got the doctor of natural medicine, and an oncologist, and who else? You've pulled these people together. Tell me about that.
Well, through the process of being treated at Hopkins, like you were saying, you know, this needs to be available to other patients. You see how it's working for me. It really needs to be available to people who aren't going to take the time to really fully research and find these things. And he said to me, you know, I am not able to even share it, even though I believe and seen its great effects with you and other patients that through Believe Big. I can't offer it as standard of care until there's a clinical trial done here in the United States. And so I said to him, let's do a clinical trial. And he said, well, Ivelisse,
it's not that easy.
It's not that easy. You know why? It's typically pharmaceutical companies are the ones who fund trials. And like you said, there's not a patent possibility for it, so they're not going to spend the money to do it. And I said, well, Believe Big's going to do it. We are going to grassroots, we're going to get the community behind us, and we're going to do all we can so that we're going to fund this ourselves. And I would say over the course of the first 3 years of just sharing that with him, I think at my 3-year mark, when he saw that scan and I was completely cancer-free, he's like, do you know how monumental this is for a stage 4 colon cancer patient that has spread to their liver, that you are cancer-free 3 years? And I'm like, I know, God did a miracle. And one of those things that he used in my life was the mistletoe, and let's do this. And he agreed, and we brought in Dr. Hindenburger and to start this process.
So let me ask you this. Did they operate on your liver?
Yes.
Okay.
So they did. We went in weeks later, and I was under the care of Dr. Hindenburger at the time as well. So he gave me some natural things to really help my body restore itself, prepare for surgery. And they took 20% of my liver, and there were clear margins. So mine was operable.
Good. Okay. Yeah, anybody watching this, you know, you can remove a cancer with surgery, but surgery does not cure cancer. No. And like Ivelisse mentioned, you know, the doctor being shocked that she was alive 3 years later, because he knows surgery does not cure cancer. Cancer is a systemic metabolic disease that involves the whole body, and it typically is caused by several factors: environmental pollution, a nutrient-deficient diet, lack of exercise and poor lifestyle choices, lack of sleep being one, prescription drug use, and stress. Stress is often the straw that breaks the camel's back in your health. And either being in a prolonged, stressful situation, and hey, I can imagine being a mother of 4, homeschooling, trying to run a business, there's a lot of stress there. Or sometimes there is some very, very catastrophic stressful events that happen in cancer patients' lives that basically bottom out their immune system, and that can be the loss of a loved one, a divorce, a really, really unhealthy work environment, or the loss of a job. So anyway, I just want to say all these things for anybody that is very new to this idea and is trying to learn. That's really what we know causes cancer. It's a breakdown in the function of the body, specifically your immune system and your body's ability to detoxify, because we all have cancer cells in our body. Cancer is a very normal thing, and when your body's functioning properly, your immune system identifies and eliminates rogue cells, mutated cells, cancer cells. But when your immune function breaks down because of pollution and stress and all those factors I mentioned earlier, that's when your body becomes a place that cancer can thrive. So that's what we want to try to prevent for healthy people and reverse for sick people. So now, Believe Big, where are you in the process of clinical trials right now? Because I'm excited, and I hope through this video I can help you raise more money to make this happen. I want to get a little credit.
Okay, well, I appreciate it. We'll give you all the credit. We appreciate it.
It was my idea.
Really exciting. We actually started last September meeting researchers at Hopkins and Believe Big and Dr. Hinderberger. And we met monthly, trying to develop a trial that would really show its effectiveness, but with cancer, with the different stages and different types of cancers, we brought in the experts in Germany because there have been many, many clinical trials done, and asked for their advice as well. And the great news for here doing one in the United States, because there have been so many clinical trials done already in Germany on mistletoe, we didn't have to start off at the animal phase, which they typically do, and test it on animals, and then go through the process of testing it on humans, because it's been done there already in Germany. So we got to skip that step, which is great.
Yeah, that's terrific.
And so right now at this point, we actually spoke with the manufacturers at the beginning of September, and they have agreed to help us by providing the mistletoe for free. So that it can help.
Right?
Walida, yes, and they're going to help to keep the costs down, because this is a grassroots initiative. It's not being funded by Big Pharma or by a hospital or corporations. It's really you and me that are funding this for the future patients in this nation.
What is the approximate cost of this trial?
Well, the exciting thing is that Dr. Diaz really worked so hard with Dr. Poller and other researchers there to say, how can we do this? Make this phase 1 trial go through, because once a phase 1 trial has gone through and we can do phase 2 and 3, we can get grant money from hospital institutions, from medical journal writings, all these things that will help those big dollar trials. But this initial one, he was able to get it down to about $300,000.
Yeah,
so it's really exciting.
Yeah, that sounds like a lot of money, but in this world, in the cancer world and the clinical trial world, that really is pretty low. But I mean, phase 2 and 3 is millions and millions.
Yes.
But that's great that it's eligible for funding. That's so cool. I love this.
Yeah, and we actually have raised so far through dinners and runs and all kinds of events $100,000 of it. So we're only $200,000 short, and we actually created a Believe Big Mistletoe clinical trial page on our website that there's a link to a GoFundMe, and 100% of people's donations that when they click on that link will go towards this trial. We have other donation links on our website to help other initiatives that we do in the community, but for this trial in specific, if someone said, I wanted every single dollar to go towards funding this trial, they'd click on that and it would go towards it.
That's amazing. I'm a little notorious for being critical of cancer charities. I have this video that's gotten a lot of views called "Why I Don't Race for the Cure," and I don't support Movember and Live Strong and a lot of these charities because I think they waste a lot of money. And bottom line is, with most cancer charities, the money, even the money that they do, they're only required by law to give about 18-19% to their to research.
Wow.
So the other 80% of the money they raise, they can use for salaries and marketing and just a bunch of meaningless stuff and awareness, whatever that is. But the little bit that they do actually give to research is usually going to the pharmaceutical industry to research more drugs they can patent and sell back to you. So again, I'm not a big fan of most cancer charities because I don't think I think they're wasting money and they're donating to research that isn't helping. But what you're doing is amazing, and I support it 100% because this is research to get a natural medicine proven and approved for use, and that is absolutely incredible. And by the way, Weleda is a great company. We'll just give them a plug. They're not sponsoring this interview, but I have some Weleda aftershave. So they make a lot of amazing, high quality health and beauty products that you can buy, retail. You can buy them online. So they're not just a nutraceutical company. They make health and beauty products, right?
Yes, they're great.
Okay, so I'm trying to think if there's anything else we left out. We talked about your diet, your 5 years out, which is terrific. I'd like to close with this. If there, for anyone watching that is newly diagnosed and they're searching for answers and they're looking for information and they don't know what to do, and they're watching this video, what would you say to them?
Well, I'm going to actually direct them to either your website and Believe Big website as well. We have actually on our website, and that's the whole reason why Believe Big got started, was because we found it really extremely difficult to navigate through, cancer and knowing who to contact and when. So we tried to use that time of struggle for us to help future patients. So what we've done on our website is we actually have a resource page, and on that resource page you'll have questions to ask oncologists, first steps. These are 1, 2, 3 things you should do once you discover you have cancer. Resources like books. On there is also the research that is being done, and I think the one that you mentioned, the clinical trial on mistletoe. So, when you're sharing information with physicians, you have something that you can actually show them. I would also encourage people to get connected with a natural physician as well that can individualize their care. So yes, you have your oncologist, but also try and find a natural physician as well that can help you if you're not well versed in the complementary medicine or nutrition, someone that can support you and coach you along that way. And really, I would also encourage them to help fight that mental battle of fear. And we have a resource page on prayers and encouragement that really your mind has the power to heal as well, and what you think. So switching those negative thoughts and replacing them, I believe, is also very important for a patient. So
I could not agree more. Absolutely, I agree 100%. It all starts here. It all starts in your mind and with your attitude and your will to live and your desire to live. And from there, that translates into your action, which is being willing to do whatever it takes to get well, being willing to change your life, change your diet, forgive, get right with God. Cancer is a divine tap on the shoulder. And it's an opportunity to change your life. And the body can heal. The body created it. The body can heal it. Nutrition and natural therapies are very, very powerful. And if you have not heard that, this is what I'm here to tell you, and Ivelisse is too, is that the body can heal if you give it what it needs to heal. If you give it the essential nutrients it needs to function properly, it can repair, regenerate, and detoxify and heal cancer. So anyway, I'm going to wrap up this interview. Thank you so much, Ivelisse, for being on.
Thank you, Chris, so much for doing this interview and for sharing with everyone what's available out there in the cancer world.
And everyone, please visit Believe Big. That's Ivelisse's site. I'll put a link on this video here. My site is chrisbeatcancer.com. And please subscribe to my channel and share this video. Thanks. See ya.
Thank you.